In this video, we will cover mindful meditation and its effects on bias reduction. We will discuss the neurobiology of meditation as well as the pathways involved in bias reduction through mindful meditation. Mindful meditation can be practiced through two different schools of thought. The first is a 2,500-year-old historical model rooted in Buddhist practices, and the second is a 40-year-old contemporary model influenced by the mindfulness-based stress reduction course created by Jon Kabat-Zinn. The Buddhist model trains on sati, which is considered to be the first step towards enlightenment, and it describes the moment-to-moment awareness and the idea of remembering to be aware. While the Jon Kabat-Zinn model trains on Buddhist teachings while integrating scientific and medical practices. Mindful meditation is commonly described as a type of meditation that encourages individuals to focus on the present and observe feelings and thoughts in a non-judgmental manner. This allows for the individual to understand and reflect upon moments that may require quick reaction and automatic judgment. In clinical literature, mindfulness is described as a form of purposeful, non-judgmental, and non-reactive attention that is focused on the present moment. Practicing mindfulness has been associated with stress reduction, reduced depression and anxiety symptoms, and enhancement in overall well-being. Some evidence suggests that mindfulness may be involved in reducing negative biases. As such, we will now delve into the neurobiology of mindful meditation and a few studies that correlate mindful meditation with reduced bias.
Affective state refers to the emotions, consequences, emotions, eliciting circumstances, or subjective feelings or attitudes. Mindfulness is associated with reduced negative affective states, increased positive affective states, and reduced clinical affective symptomology. It has been suggested that mindfulness is associated with self-reported and clinically relevant changes in emotion processing. Neurobiological model of emotion processing describe a ventral core affective states responsible for establishing the threat or reward values of a stimulus, and a more dorsal affect processing system responsible for appraisal and attribution of one emotional state.
The ventral system for core affect has been described as including the temporal lobe structures, including the amygdala, insula, anterior cingulate cortex, orbital frontal cortex, and ventral medial prefrontal cortex.
It is thought that this neuroanatomically coupled ventral network communicate the value of affective stimuli quickly and efficiently to the hypothalamus and the brainstem areas for coordinating a behavioral response. These models indicate that explicit and implicit emotion regulation strategies activate regions of dorsal and ventral prefrontal cortex, including the dorsal anterior cingulate cortex, for modulating affective response regions such as the amygdala.
Two studies of trait mindfulness and emotion processing found mindfulness to be associated with increased prefrontal cortex activity and reduced amygdala activity in response to affective stimuli. Both of these studies used regulatory experimental instruction while participants were viewing affective stimuli.
In addition, affect labeling caused increased activity in a single brain region, the right ventrolateral prefrontal cortex, and it is evident to be inversely correlated with the amygdala activity during affect labeling, and is mediated by the medial prefrontal cortex. These results suggest that affect labeling may diminish emotional reactivity along a pathway from the right ventrolateral prefrontal cortex to medial prefrontal cortex to the amygdala.
One study examining mindfulness and cue-induced cigarette craving in meditation-naive participants also found that a mindful attentional span reduces neural activity, regions implicated in the core affective reactivity. In these studies on mindfulness and craving, mindfulness instruction led to reduced self-reported cigarette craving and reduced neural reactivity to smoking cues in nicotine-deprived smokers.
The anterior cingulate cortex play a central role in the craving response of dependent smokers. Mindfully attending to smoking cues not only reduce craving-related subregion anterior cingulate cortex activation, but also reduce its functional connectivity to other craving regions, such as the ventral striatum. One of the benefits of mindfulness meditation practice is this process of creating new neural networks for self-observations, optimisms, and well-being. Through mindfulness meditation, we light up and build up the left prefrontal cortex, associated with optimism, self-observation, and compassion. Allowing ourselves to cease being dominated by the right prefrontal cortex, which is associated with fear, depression, anxiety, and pessimism. As a result, our self-awareness and mood stability increase as our harsh judgment of others and ourselves decreases.
By devoting attention, intention, and daily efforts to being mindful, we learn to master the mind and open the doorways to the creativity available in open-minded consciousness. These findings suggesting a link between trait mindfulness and reduced emotional reactivity are important because emotional reactivity is central to dysfunctional emotion regulation. Dysfunction in emotion regulation is a core component in disorder of anxiety, mood, substance abuse, and eating disorder.
This emotion regulatory effect of mindfulness meditation could have further clinical implication with treating anxiety disorders. A randomized longitudinal study by Kosal reported that people suffering from generalized anxiety disorder showed a shift from negative activation correlation between frontal region and amygdala to positive activation correlation between the two areas after 8 weeks of mindfulness-based stress reduction. The enhanced amygdala to dorsal ACC connectivity following the mindfulness-based program might be related to improved regulation of arousal states. This is aligned with the finding that meditation practice regulates autonomic nervous system. This increased connectivity was also negatively correlated with Beck Anxiety Inventory, BAI, supporting meditation's clinical effectiveness. Perhaps fear extinction by mindfulness meditation may have a more generalizable effect than the context-specific exposure therapy, as the capacity of mindfulness meditation to monitor and control the state of one's mind is not specific to a certain context. Mindfulness meditation is also known to reduce bias by reducing stress level. According to Cohen's overload hypothesis, the informational demand to constantly monitor unpredictable stressors and task requirements could lead to cognitive fatigue that leads one to use automatic associations such as heuristics, stereotypes, and implicit bias. Therefore, by reducing stress through mindfulness meditation, one could free up cognitive resources to prevent judgments based on automatic associations. This bias-inducing effect of stress can be demonstrated both behaviorally and neurologically. A study showed that chronic stress could lead to less flexibility and attention shifting in both rodents and humans. This behavioral pattern was also associated with less apical dendritic arborization in the ACC of rats and fewer feed-forward PFC connections in humans, which recovered after the stress stimuli was removed. This leads to a question. How does mindfulness meditation regulate stress in a way that frees up cognitive resources to prevent automatic stereotype activation and encourage more rational judgments? A study by Davidson and McEwen showed that stress increases the volume of amygdala, but reduces PFC and hippocampal volume. Mindfulness meditation produced the exact opposite effect. After mindfulness meditation, not only was there an increase in gray matter density in the hippocampus, but also a reduction in perceived stress correlated with reduced amygdala gray matter density. This showed that mindfulness meditation could be an effective stress prevention strategy that can improve self-regulation. Therefore, its stress prevention strategy could prevent automatic stereotype activation and reduce biased choices and decisions by regulating one's receptiveness to external stress. The introducing effect of mindfulness meditation may have a significant implication on policing. Because police work on a high-stress environment, the high stress subjects the officers to automatic bias judgments and discriminations. A study by Carell and his colleagues showed that officers who were under stress, arousal, and high cognitive load, such as multitasking, showed greater signs of racial bias in their decisions to shoot. These high-stress environment and circumstances make it difficult for officers to override their implicit bias and consciously direct their focus on their presence with the absence of weapon. 4. Stress could have a deleterious effect on depriving the officers of cognitive control that is responsible for suppressing bias and making rational judgments. Mindfulness meditation has also shown its effectiveness in reducing implicit race and age bias. In a study by Luke and Gibson, subjects were asked to listen to a 10-minute audio tape that focused on the individual so that they could be more aware of their sensations and thoughts in a non-judgmental way. Those who listened to this 10-minute audio tape showed less implicit bias against Blacks and old people on the race and age IITs than those who listened to a 10-minute audio tape describing historical events and geographical landmarks. Therefore, mindfulness meditation was able to reduce the automatic activation of negative associations with a target group. This study does not show whether the observed reduction in implicit bias is reflected on the reduction of prejudice behavior. In another study by Luke and Adam, the prejudice behavior was assessed through conducting trust game. The game tested how trusting were the subjects of an individual of different race with their money. The results showed that those who listened to the 10-minute mindfulness audio tape exhibited significantly less discrimination in the trust game than any of the other control conditions. Therefore, this result showed that mindfulness meditation is effective at not only reducing implicit bias, but also in reducing one's prejudice behavior.
As previously mentioned, human intuitive thinking and decision-making tendencies are guided by heuristics, attenuated ways of thinking, and maxims. Cognitive psychologists believe that about 95% of our time thinking is spent on intuitive mode. Practicing mindfulness can help us be more aware of our surroundings and automatic responses. To explore this idea, we will turn to physicians, who are often encouraged to practice mindfulness during patient visits as a way to minimize bias, which is a principal factor in diagnostic error. Take the case of a 55-year-old man who walks into the clinic at the end of the day. The clinic has been busy and will be closing soon. The man complains of constipation with no bowel movements for 4 days. He complains of lower back. He was seen by a physician briefly, but no abnormalities were found in his exam. He was prescribed with a strong laxative and sent home. That same night, the man was unable to urinate and he was rushed to the ER. He was taken to the OR for surgical decompression due to cauda equina and a swollen lower abdomen. His symptoms improved and he regained full bladder control. In this case, the patient was misdiagnosed and could have suffered from permanent bladder function loss. By practicing mindfulness, the physician would have been more likely to consider seemingly unrelated symptoms into their diagnosis. They would have relied more on the present situation rather than based on cases that they have seen before. Because of our susceptibility to rely on biases and intuitive thinking, professionals such as law enforcement officers, lawyers, and judges would benefit from incorporating mindful meditation, since they are often presented with situations that affect others' lives. In addition, mindful meditation has been successfully incorporated into various clinical interventions that help members of society. These interventions include mindfulness-based cognitive therapy, which is involved in depression relapse prevention, and mindfulness-based relapse prevention for substance use addiction. In this video, we reviewed a brief history of mindful meditation. We discussed active brain regions involved in mindfulness meditation and emotional processing. We reviewed various studies in which mindful meditation showed positive effects in debiasing, and we learned about the role of mindfulness in a large societal scale in reducing biases.